Good afternoon and welcome to the CAQH webinar, Keys to Improving Your Credentialing Process. My name is Karen Waller. I'm the Communications and Marketing Director for CAQH, and I will be the moderator for today's webinar. Before we get started, I'd like to review some housekeeping details for everyone listening in today. Today's session is being recorded, and you will receive a link by email to the on-demand webinar that you can share with others. That will be both the recorded webinar and the slide presentation will be posted tomorrow on our website. So look for that tomorrow, and we will send you an email tomorrow. Your phones will be muted throughout the webinar today. All questions should be submitted online. You can simply ask your question at any time throughout the session. Just type your question into the right-hand side of the GoToWebinar panel, and we will address your questions at the end of today's presentation. Now I'd like to introduce today's presenters. They are Jessica Maselli, who is Senior Product Manager at Aetna, and also TJ Theogaraj, Senior Product Manager at CAQH. TJ, I'm now going to return the presentation over to you.
Thank you, Karen. Good afternoon to all of our audience, and thank you for joining us as we talk about ways that you can improve your credentialing process. We'll start today with a brief background of CAQH and then get right into it as we share with you what CAQH identified as common industry challenges to a crucial part of the credentialing process. We'll then take a quick overview of Verifide, our solution to these challenges. We'll learn from health plan Aetna how they changed their business processes to capitalize on the efficiencies that this solution makes possible and hear about their outcomes. We'll wrap up with a quick summary of the benefits that Verifide provides to a health plan, and I want to make sure that we leave time at the end for questions from the audience. So a little bit of background for those of you who may be unfamiliar with CAQH and the work that we do. We are a non-profit alliance of health plans with a sharp focus on reducing inefficiencies in the healthcare system. Our strategic objectives are driven by our member organizations, which consist of the 12 health plans and 2 health plan industry associations that you see on the screen. We meet our goals through a few different initiatives. The CAQH Core, the Committee on Operating Rules for Information Exchange. CORE works collaboratively across healthcare industry organizations, so payers, providers, clearinghouses, software vendors, etc., to write operating rules to facilitate the exchange of data between these entities. CAQH Solutions builds technology applications that are used by healthcare entities, payers and providers primarily, to efficiently collect and share data with each other. And finally, CAQH Explorations collects, analyzes, and disseminates information and statistics on the performance and adoption of various healthcare electronic transactions, with the goal of enabling other organizations to make better informed decisions. CAQH Solutions provides several technology solutions to help health plans manage their provider data, as well as a solution to manage coordination of benefits for members. Now, of course, as credentialing people, most of you are probably familiar with CAQH ProView, which is our solution for provider data collection. But you should know that we also have solutions for provider directories, primary source verification, which we'll talk about in more detail today, sanctions monitoring, EFT and ERA enrollment, and coordination of member benefits. If you'd like to learn more about any of these solutions, I encourage you to visit our website, www.caqh.org. All right, so with all of that done, let's talk about credentialing. Here at CAQH, we think of the credentialing workflow as consisting of these 4 broad activities. So first, there's an application gathering process where the health plan collects a large amount of really pretty detailed information from the provider. That's followed typically by a primary source verification process where you're attempting to verify some of what the provider told you about themselves in their application. And note, of course, that's self-reported data, but attempting to verify that against a relevant primary source. So not only is this good practice, it's also something that's required by accreditation agencies such as NCQA. You then use the information that you've collected and verified to take a decision on whether or not to accept that provider into your network. And this is typically done through some kind of committee review or decision process. And then finally, once the provider is in your network, you need to perform some kind of ongoing monitoring of that provider to make sure that you're checking for sanctions, exclusions, debarments, and so on. For a while now, CAQH has provided tools to support two parts of this process. CAQH ProView for the application gathering piece, and Sanctions Track for ongoing monitoring. A couple of years ago, the health plans that make up our board directed us to investigate the primary source verification process to determine if there were opportunities to make it more efficient. We worked directly with credentialing executives, managers, and staff in a number of different health plans, and here's what we found. We saw that there were several challenges that this process throws up for both health plans and providers. So on the health plan side, number one, for a number of the verifications being performed, the health plans are having to pay high data acquisition fees to the primary sources of this data. Second, health plans individually are unable to leverage economies of scale to make the process truly efficient. And this is particularly true for small to medium-sized plans. For the majority of health plans, primary source verification continues to be a manual process. And what this means is that it's often slower and more error-prone than it could be if it were automated. And finally, health plans face considerable provider abrasion as providers see multiple health plans reaching out to them to request the same information as a wasteful administrative overhead. Now, in addition to the redundant information requests, on the provider side, there's other challenges as well. So providers struggle with the long wait times that this process causes before they are able to participate in a health plan's network. And finally, the variations that providers face in health plan requirements, again, is something that increases the administrative burden on the provider and causes greater frustrations. So as you might have recognized, a number of the problems that I talked about in the previous slide are systemic in nature. It's hard for any one health plan to solve these problems individually, and they are instead best solved via a collective, industry-wide approach. And so earlier this year, CAQH launched Verifide, which is an industry-wide solution for primary source verification. The goal for Verifide is to do with primary source verification exactly the same thing that CAQH ProView has done with the application gathering process. In other words, take a process that health plans were doing individually and therefore somewhat redundantly and with a great deal of variation, and create a shared solution that the entire industry can use. By reducing or eliminating the redundancy and by leveraging efficiencies of scale that are made possible by doing this industry-wide, this process can now be performed at a lower overall cost. And as a non-profit organization, CAQH then passes these cost savings directly onto the health plans that use the solution. So for the health plan, that's something that resolves in a lower cost of performing this process as well. Now, Verifide is a solution that was designed by health plans for use by health plans. And the solution is based on 4 key principles that are used to solve systemic problems that we previously identified. So first and foremost, utilizing a standardized industry-wide data set for primary source verification. The verified primary source verification is aligned with NCQA standards, although of course we do some additional checks as well. And it's worth mentioning here that CAQH is an NCQA certified organization. The second core principle is to keep to create deep integration with the credentialing application, and to have a lot of automated verifications that are performed against primary sources. This is in order to increase the speed of the process and to reduce errors that might creep in due to manual processing. Third, align provider recredentialing dates across multiple health plans in order to reduce redundant effort, save on data costs, and reduce redundant outreach to providers. So we are in an industry today where the same provider is being credentialed at different points in time by multiple health plans. The goal here is to realign those credentialing dates. And finally, delivering outputs to health plans in a way that makes it possible for the health plan to easily automate their own internal processes. So in other words, not just automate the process within CAQH, within Verifide itself, but also make it possible for the health plan to drive greater automation internally. So enough from me for the moment. I'm going to turn things over to Jessica Micelli, Senior Project Manager for Aetna's Provider Data Services and Credentialing Group. Jessica is going to talk about the changes in Aetna's credentialing process that they've made through adoption of Verifide and the outcomes that they're anticipating. Jessica will also walk us through some key Verifide features that Aetna is leveraging to drive those outcomes. Jessica, over to you.
Great. Thank you, CJ. Hello, everyone, and good afternoon. Prior to using Verifide, the Aetna CBO conducted primary source verification and entered the results into the provider data management and credentialing systems. Analysts complete all levels of PSV to build a complete file package. With the Verifide integration, Aetna receives a completed PSV file from CAQH to load into the provider data management and credentialing systems. An internal database routes the files once received from CAQH based on file type, date, and categorization, which we will discuss in more detail shortly. The Aetna CBO performs any additional PSV needed, reviews to ensure the practitioner meets internal business criteria, and then the provider moves on to credentialing committee for review. Having the PSV completed by CAQH allows the Aetna credentialing staff to focus on more complex scenarios. Next, I will discuss how Verifide has helped to improve the Aetna process. There are 4 ways Verifide has helped improve the process. Number 1, because all outreach is coming from one source versus multiple outreaches from both CAQH and Aetna, there is less provider abrasion. Practitioners are contacted at the same time to both complete their ProView application and complete PSV. Number 2, Aetna has been able to modify some internal credentialing processes to align with NCQA and industry standards as a result of the Verifide transition. Number 3, we anticipate that transitioning PSV to CAQH will allow Aetna to remove some of the high-cost fee sources needed for credentialing, as CAQH will now be utilizing them. And number 4, although it still is early in the transition, quicker turnaround time is expected for both initials and recreds. Now let's take a look at some examples of what is delivered from CAQH. This slide depicts a visual of both the human and machine-readable format of the Verifide checklist that CAQH delivers. Aetna utilizes the machine-readable format to automate the primary source verification data directly into our provider data management system. Existing technology was leveraged and was updated to take the data from the machine-readable checklist format and the ProView application. The human-readable format is utilized by an Aetna analyst to review the outcome of primary source verification and determine what the next steps for the file should be. The checklist provides a quick overview of the key results of PSV without having to dig through all the individual verification evidence, although this verification evidence is also available for reference. There is also a grid showing a summary of number of elements with different categorizations, which allows the analyst to quickly scan just the top of the checklist and see if there are all A's or if there are any non-A's that require a closer look. Just below the grid is a file notes section where the analyst may include some additional useful information. Additionally, information is provided at the level of each data element, as depicted in this slide under the malpractice insurance data element. Next, we will review the additional data delivered. In addition to the machine-readable and human-readable checklist, CAQH also delivers verification evidence and an outreach log for each file. The verification evidence includes copies of the primary source verification completed. Examples of this are the NPDB report, DEA query, license verification, etc. The outreach log details each outreach that was made to the practitioner and includes the phone and fax number, individual spoken to at the office, date, time, and details of the call. Now let's take a more in-depth look at the categories. On the Verifide checklist, data elements are categorized by letter. Category A means all elements are valid, current, and unrestricted. Category B means at least one element has some potentially irregular results. Category C means at least one element has very irregular results. Category D means at least one element was confirmed to be deficient after outreach to the provider. And Category Q means CAQH was unable to obtain verification of at least one element after outreach to the provider. For example, for board certification, a Category A indicates valid, current board certification. Category B would indicate that the board certification has expired. And Category C would indicate that the board certification has been revoked. As mentioned in a previous slide, Aetna has built in automation to route files to different work queues based on this file categorization. The majority of files are delivered with all elements categorized as A, which allows us to perform minimal additional processing and take the file to credentialing committee shortly after delivery. Although the current automation routes on the file level classification, we are exploring the option in the future to be even more granular and set up rules based on individual data element categorization, state, and so on. Now I'll turn it back over to TJ to discuss the verified benefits to health plans.
Thanks for walking us through that, Jessica, and for sharing a little bit about the changes that Aetna's made to your internal processes, as well as some of the capabilities that Verifide makes possible that you're leveraging to drive process change within your organization. So Jessica talked us through and pointed out a few key features. What I'd like to do now is to just have a quick summary of the key benefits that health plans utilizing Verifide can expect to see. And we'll also just talk about how some of those benefits are actually realized internally within Verifide. So first and foremost, Verifide helps speed up the turnaround of primary source verification. And there's a couple of different ways that we do this. Firstly, there's the direct integration between the CAQH ProView credentialing application and the Verifide system. What this means is that there are no delays in accessing the provider's credentialing profile. Even in cases when they may go in and update and reattest in the middle of primary source verification itself, we're able to get that updated, reattested credentialing profile in the middle of that process without any delays. That's in terms of getting the application from ProView, but there's also automation that has been built in for the actual verification checks that are performed. So to give you a few examples, checking of the provider's licensure is something that's been automated. It's not a manual process that analysts are working through. So automation of these different primary source checks is something that allows us to further accelerate the process. All of these are things that allow Verifide to turn around initial credentialing files within 14 days for the majority of files, and for recredentialing to return files no later than 60 days before the recredentialing date. And we're confident in these turnaround times, and these are actually written into service level agreements in the Verifide contract. The second benefit is an increased level of quality. So the highly automated process that is used within Verifide includes, besides the automation and the automated checks against primary sources, there's also system rules-based decision logic. And what this allows us to do is remove some of the subjectivity in the decision-making process. So rather than individual analysts having to take decisions on what needs to be done, there are rules that are created and keyed into the system, and then based on things like the provider type or the state where the provider is practicing, the system automatically determines what types of verifications need to be performed, points out the different sources that that the analysts have to go to make these verifications, and so on and so forth. So this, along with the reduction in data entry, leads to fewer errors. And so we're able to say that Verifide will deliver files with a 98.5% accurate and complete rate. And again, this is something that we've spent a lot of time and effort building into the service, and we're confident enough in it that, again, this is something that's written into our service level agreements as well. The third key benefit that we like to talk about is the increased efficiency for the health plan itself. So the things that I spoke about earlier are ways that Verifide performs more efficiently internally through automation. But the way that we collect and make these outputs of the primary source verification process, the way we send them to the health plan, are things that allow the health plan as well to get greater efficiency internally. So as Jessica has already walked us through, Aetna has been building automation to consume the output from Verifide. Jess talked about how the machine-readable primary source verified files can be automatically consumed by health plan IT systems, while the data element categorization, so the A's, B's, C's, etc., of the different data elements, that's something that facilitates internal routing capabilities based on different file outcomes. So all of these are things that we've designed so as to allow the health plan to take and to utilize to make their own internal processes more efficient. And just to reiterate the point that Jessica made, at present, Aetna has built the routing based on the high-level file classification, but they've recognized and are examining ways to use a more granular approach to be even more nuanced in how they're routing their files. And finally, of course, the fourth key benefit that Verifide delivers to health plans is the ability to have lower costs. As part of creating Verifide as a centralized, industry-wide solution for primary source verification, CAQH has been able to leverage significant economies of scale in order to perform the process more efficiently, investing a great deal in things like automation in order to reduce costs. And so this is one of the things that allows us to ensure that the health plan utilizing Verifide has lower costs. I should also note over here that within our pricing model, health plans that use Verifide for primary source verification of a provider will also get 3 years of access to that provider's ProView data. So there's additional cost savings for the health plan to get from the combined use of the Verifide and the ProView solutions together. So everything that we went through so far was with the intent of giving you a little bit of an overview of a new tool that CAQH has rolled out. If you recall from a prior slide, we already provide tools for the application gathering process, for ongoing monitoring. We wanted to round that out and fill the gap in that primary source verification process, try to solve some of the systemic industry-wide problems that we're seeing, that both health plans and providers are facing. And so I hope that this presentation that we just went through was helpful in highlighting how this new solution gives health plans these additional tools to help make their credentialing process faster, better, cheaper. If you have a need for additional information, we've got some time now where we'll open the floor up to questions. We'll attempt to answer some of those. And of course, if you have further questions or would like a more in-depth explanation of how Verifide works and go through all of the details, please feel free to reach out to us. We're happy to have someone get in touch with you and follow up for more information.
Thanks, DJ. Now is the time during the webinar when we answer questions from listeners. And again, please submit your questions by entering them in the questions section of the panel on your right-hand side of your screen. So we do have several questions here. First of all, to TJ, it's often a struggle within our organization to get IT resources. Is it possible to use Verifide without any IT work on our side?
Oh, that's a great question. And, you know, it's definitely something that we've been asked before as we're out talking to other health plans and they want to adopt the solution. Understood and acknowledged that that's a struggle for some health plans. And so in the course of this presentation, a lot of what we've been talking about has been the capability or the possibility for a health plan to utilize verified outputs in an automated fashion and to build a lot of automation that will streamline their process internally. What I should also make clear is the fact that, you know, you don't have to do that. Typically, what we recommend as an implementation process and the way a lot of health plans adopt Verifide is to start off by utilizing the solution in a manual fashion. So in other words, we go through an implementation process, the health plan starts to place orders for primary source verification. We'll perform that verification and send the output back to the health plan, but they then have their staff manually picking up those delivered files and loading them up into their own system, sending the files on to committee for decision. That's absolutely possible, and in fact is what our recommendation is: start off manual. And then as you get a better understanding of how the process works and start to recognize opportunities for you to drive even greater efficiency by building some kind of automation, that's when we would recommend that you start to get your IT folks involved, start to talk about ways that you can automate that process and make the business case internally as well for the fact that making some investment in internal automation is going to drive further cost savings. So absolutely, I'd say short answer, yes, you can use Verifide as is without the need for any IT project or IT investment, and you can then achieve greater efficiency and greater cost savings through a subsequent later stage IT implementation.
Thank you, TJ. Second question is for Jessica. How have you seen this process working so far for Aetna?
So far, the process is going very well. We began transitioning recreds in March to CAQH, and they are currently processing recreds for Aetna in approximately 40 states. The initial transition has just begun, and CAQH started processing our initial files just this month. So we do not have any initial files delivered just yet. We do continue to plan this transition throughout 2017, so it has not been completed just yet. And as this is a new process within the company, we are continuing to evaluate this, and we will streamline where we can.
Thank you, Jess. Okay. A question for TJ. Does Verifide provide ongoing monitoring of sanctions?
So I think the answer to that question is that CAQH has solutions that include ongoing monitoring of sanctions. Some of you recall from some of the earlier slides we had where we showed the different steps in the credentialing process. We've got ProView that handles the application gathering. Verifide is designed to perform primary source verification. And then we do have something called Sanctions Track, which covers the ongoing monitoring of sanctions. So just to quickly summarize, Verifide itself is a solution that's focused on primary source verification. If you need something for ongoing monitoring of sanctions, then Sanctions Track is a complementary solution that we also offer.
TJ? There have been several questions about the lists of sources that are used to verify a provider's credentials. A specific one is SSDMF included on the verification list. Can you talk about how someone can obtain a list of the sources for the credentialing sources that Verifide uses?
Sure, absolutely. That's a great question. We've talked a lot about the fact that Verifide performs primary source verification without necessarily going into the details of what we actually check. What I'll do to answer that question is cover the list of verifications that we perform. The list of data sources, or the list of primary sources that we utilize, is fairly extensive and not something that we can go into and cover comprehensively in this call, but it's definitely something that we're happy to talk about if you need more details and would like to reach out. So a quick overview of the different data elements that are in scope for Verifide. We check the state license, so we verify that all licenses that the provider has, all states that the provider has indicated they practice in, that the provider actually is licensed to practice in those states. We check for DEA and CDS certificates. This is something that's dependent on the provider type. So while we do this check, we wouldn't do it for all provider types. For board certification, if the provider has indicated that they are board certified, that's something that we would check. And we utilize sources such as ABMS, the AOA Physician Profile Report, etc. We check for sanctions, license sanctions. So at initial credentialing, we'll check for any action. For re-credentialing, we have a 5-year look-back period. This is something that comes from NPDB. We also check for Medicare and Medicaid sanctions. Again, for initial credentialing, we check any action and report that. For re-credentialing, there's a 5-year look-back period. And again, this is something that comes from NPDB. And then we check malpractice history as well. Similarly, any action for initials, 5-year look-back. For re-credentialing, this is also from NPDB. Then there's other things like malpractice insurance. So checking that there is a valid PLI coverage and the provider has updated a PLI face sheet and made that available. We check for hospital privileges. With hospital privileges, there's a little bit of variation from state to state. So in general, hospital privileges are checked against what the provider actually reports. There are certain states, I forget the exact number, but there are certain states that actually have regulations that hospital privileges be verified directly with the hospital itself. And so that's something where if the provider is practicing in one of those states, we will check with the hospital. We also do a check for Medicare opt-out. So checking against the different MAC listings to see if the provider has opted out for Medicare. There are exclusions checks we do against the OIG data source. So there's an OIG sanction check. And then finally, as far as exclusions are concerned, SAM as well. And then specifically for initial credentialing, so we don't do these for recreds, but for initials, we will also check education and training. And then work history is also something that's checked for initial credentialing. We look at 5 years of relevant employment history, and there's a need for the provider to give an explanation for any employment gaps greater than 6 months. So, as you can see, just going through the list of the different checks that we perform is fairly extensive. If you want to know the specific primary sources that we check, I'd encourage you to reach out to us offline, and we'd be happy to provide you with more information.
Thank you, TJ. Some related questions. So would a health plan need to sign up for all elements of the credentialing process, so ProView, Verified, and Sanctions Track?
Sure, great question. So the health plan would need to have rostered their providers for ProView. That's how we get the provider's credentialing application. I think I mentioned it earlier, but it bears repeating. If the health plan is using Verified, then access to that ProView data is already included in the cost of Verified. So you're not paying extra for ProView, and that's included as a package. And then depending on the health plan's internal process and desire, if you want sanctions, ongoing monitoring of sanctions as well, then Sanctions Track is a separate service offering that CAQH makes available. That will be something that's separate. So short answer, the health plan does not need to sign on for both Sanctions Track and Verified and ProView. If you are using Verified, ProView is already included anyway.
Thank you, TJ. A question to Jessica. As a provider that seeks credentialing from health plans, how does Verified help us streamline the process between us and the health plan?
As I said previously in one of the slides that I reviewed, there is less provider abrasion with the Verified process. Instead of the provider receiving multiple outreaches from multiple health plans and CAQH, now it's CAQH that's doing the outreach on behalf of the plan, and then also obtaining the data that's needed to complete the ProView application. So it streamlines the process that way, but it also is also blind to the practitioner. So the process has been built with the intention of having minimal, if no, impact on the practitioner, as these are internal processes, and it should only make things easier for the provider.
Thank you, Jessica. Another question, can you go into a little more detail of the actions taken when a verification is done and more information from the provider is required? And that will be to TJ.
Yeah, good question, and thank you for asking that, because actually one of the things we didn't talk about in the brief overview that we provided was our outreach process. Of course, Jessica alluded to the outreach log and provided a little snapshot of what that looks like, so you know that we do include outreach. But let me talk a little more about what that outreach process is like. So, absolutely, as the questioner pointed out, there are situations where we don't have everything that we need in the ProView application itself, and there's a need to reach out to the provider to gather additional information. So we do have an outreach process to get this information. As part of the service, Verified performs at least 3 outreach attempts. We often find that we are getting a response from the provider, there's engagement there, we just need to follow up a little more to get missing information. So I've certainly seen cases where we've done 6 or sometimes made 7 outreach attempts. But at a very minimum, we'll make 3 attempts. At least 1 outreach attempt is performed by way of phone. So we'll use both email and phone, but be assured that at least 1 attempt is performed using phone. And if we find that that's the channel that that particular provider prefers, we'll continue to use phone to engage with them. We make our first outreach attempt no later than 5 days of starting work on a particular file. This is to cover the case where there are certain states that have some more stringent requirements around the time between starting work and notifying the provider of any missing information in their profile. So although there are only a few states that have this more stringent requirement, it's something that we just adhere to across the board. for all states. So first outreach within at least 5 days of starting the file. We ensure that we have a minimum of 2 days between 2 successive outreaches. The intent here is to give the provider enough time to receive our outreach, take whatever action that they need to collect any missing information, etc. So we don't want to be in a position where we're making 3 outreach attempts, but we're doing it by doing one on Monday morning, one Monday evening, and another Tuesday morning. We ensure that we have adequate time between outreach attempts for the provider to respond. And then finally, we ensure that our last outreach attempt is at least 2 days before we close the file and return it to the health plan. And this is with the same intent. It's to make sure that we've conducted outreach to the provider. We're giving them enough time to take action on that outreach and supply us with any additional information. So that's in terms of the process and the timelines. The people that we outreach to are the credentialing contacts listed on the provider's credentialing application. And if there are multiple contacts, we will perform outreach to those multiple contacts and then continue the conversation depending on who actually responds to us.
Thank you, TJ. I'm going to ask 2 questions together. The first one can be very brief. Is the CAQH application web-based? Is Verifide web-based?
Yeah, so just to a little bit of clarification, the actual provider credentialing application is CAQH ProView. That's something that is a web-based application. Providers can access that. They don't need to install any software. They just need a browser and an internet connection. Then they go online and fill in their information in that application. Verifide itself is something that is actually transparent to the provider. Verifide is a service that we have that's operating behind the scenes to take whatever the provider filled in their ProView credentialing application and then perform primary source verification on that information. And if the provider has sent a complete application, if there's all the information in there, the provider never actually hears from Verifide. The only time the provider would actually know of the existence of Verifide is if there's information that's missing in their application. That's when we would perform outreach to them to try and get some more information.
Thank you, TJ. Let's see, another question, what is the typical implementation time for Verifide and what is required for that implementation?
Sure, good question. Shows you're starting to think about just the process of actually going down this path. The implementation time varies somewhat depending on the size of the health plan, the size of your provider network that you need to transition over to Verifide. So we have examples of smaller sized health plans where they've made the decision to just switch over completely in one go. And that's something where the implementation can be done within a period of 2 weeks, 2 to 3 weeks. And what that implementation typically entails is upon completion of or upon execution of a contract, we do some setup on our side to get the provider, to get the health plan turned on for Verifide. This is assuming they're already using ProView. Once that's done, we will conduct some training. The training typically is about 2.5 hours of training just to make sure the health plan understands the different processes involved. Then we'll work with the health plan to get an updated recredentialing roster. This is just a schedule of recredentialing they need to perform on their providers. We'll load those up into the Verifide system and then start the process of performing primary source verification based on when a particular provider is due for recredentialing. So that's the fairly easy implementation. Where it gets a little more complicated is for a much larger health plan that maybe is operating in multiple markets. In that case, and this is really dependent on the health plan's preference, but the plan may decide that they want to transition re-credentialing from whatever their existing method is over to Verifide in a more staged fashion. So some health plans choose to do this by selecting individual providers and transitioning them over a period of time. Other health plans may decide to do it based on different states within which they're operating. So phase 1, transition over 1 or 2 states. Phase 2, once they've achieved some level of stability there, transition over the next set of states, so on and so forth. So the actual work that's involved in doing the implementation is not very large, can be done within the course of about 2 weeks. What might take a little longer is if the health plan has a desire to phase it out over time, just to manage that transition a little more carefully.
Thank you, TJ. Several questions about pricing. If our organization is currently using ProView, is there an additional cost for Verifide? And what is the pricing structure? How can we get information about that?
Sure, happy to take that. So if your organization is already using ProView, you are currently paying a ProView provider fee. That's a per provider fee. Verifide has a slightly different pricing structure. With Verifide, you would be paying per PSV file that we would deliver to your organization. And that really depends on what your provider re-credentialing schedule is like and how that's spread out over time. There is a different fee for that Verifide PSV file, but what that does include is access to that ProView data. So you would stop paying what you're paying today for ProView. You would pay only for Verifide, and you'd get ProView included in that. The pricing varies. There's a couple of different factors. It depends on the number of providers that you have in your network. We've got a couple of different tiers. It depends on there's slightly different prices for initial credentialing versus for re-credentialing. Initial is a couple dollars more because there's additional checks that we are performing. What I would recommend is, if you'd like to know what pricing would look like for your specific organization, you can definitely reach out to us. I think once we get to the final slide, there's an email address that you can utilize to reach out for more information, and someone will be happy to get back to you with what pricing looks like for your organization.
Thank you, TJ. We've received several questions asking how companies can obtain a copy of this webinar or the slide presentation. And to repeat, all individuals who are participating in the webinar today or who registered for the webinar will be sent in a couple of days a copy of the webinar, as well as a link to that deck. Another question. Is there any automation that can be utilized between Cactus and Verifide, since our company currently uses Cactus?
Yeah, that's a great question. That goes to the point that we were making earlier about the outputs of Verifide being delivered in a way to facilitate automatic consumption by the health plan. CAQH directly does not have a partnership or a tie-up with Cactus. However, I am aware of organizations that utilize Cactus who have been in discussions with Cactus about implementations or projects to automate the consumption of this software. So I do know that it is possible, but that's a conversation that you would want to have with your Cactus vendor.
Thank you, TJ. A question regarding allied healthcare providers. Are allied healthcare providers included in Verifide? And is there anything different about the credentialing process for those providers?
Sure. Verifide does cover allied providers as well. In fact, the scope of providers covered by Verifide is all provider types included in ProView. So I think ProView has 44 different provider types. Verifide performs primary source verification for all of those providers. In terms of the process itself and any variation, yes, there is a slight variation verification and process depending on the provider type. As I mentioned earlier, there's a rules-based decision logic that's designed to identify what verifications are needed for different provider types. So to give you an example, if it's a physician, maybe a DEA certificate is required because they may be prescribing. On the other hand, for a non-physician, for an allied provider type, a DEA certificate may not be a required data element. Something similar with hospital privileges. For things like board certification, if it's an allied provider and they're not board certified, then there isn't a requirement that we perform primary source verification for those. But short answer, yes, Verifide covers all of the provider types that are included in ProView.
This is a repeat question, but just articulated, is CAQH a certified credentialing verification organization through NCQA?
Yes, CAQH is certified by NCQA. We received our certification back in 2016, I think. So yeah, CAQH is certified by NCQA.
Okay. Thank you. There have been several questions from healthcare organizations. We are repeatedly asked for information for our providers regarding, and they want it through CAQH ProView, but our providers are not part of CAQH ProView. Must a provider be part of CAQH ProView to be included in Verifide?
So if I'm understanding the question correctly, it's can a health plan utilize Verifide for primary source verification of a provider that's not in ProView? At this point, the short answer to that question is no. The provider has to be in ProView in order for us to perform primary source verification of that provider. Until now, actually not something that's been a problem. If you are interested in the solution, if it sounds like something that's attractive, but you think that you have a certain percentage of your network that is not currently using ProView, we'd be happy to hear from you, get a little more information about that problem, and figure out what's a good way to move forward with that.
I think it's also worth mentioning, TJ, that there is no cost for healthcare providers to participate in CAQH ProView, and they can go into CAQH ProView and complete an application without currently being on a health plan roster. Is that correct?
That's right. So Verifide doesn't change anything about ProView. ProView is a credentialing application that is free for providers to use. A provider can go in there, just off the web, create their own account and start to enter information about themselves. The advantage there, of course, is they do it once within ProView, and then that information can be sent to multiple health plans that have that provider in their network, and it's free of cost to the provider.
Okay. There have been several questions that people have sent regarding requesting additional detail around the actions that Verifide takes when more information from the provider is required, or it is difficult to obtain information from the provider. And as part of that, how long will CAQH attempt to verify information from the provider?
Sure, great question. As I said earlier, we do have an outreach process to attempt to get information when it's missing from the provider profile straight off the bat. So we'll conduct at least 3 outreaches. Of those, at least one of them will be via phone. If the provider is completely non-responsive, then we don't go further. However, if we do get any kind of response from the provider, we find that we're often performing multiple outreaches. In other words, more than 3 outreaches, sometimes as many as 6 or 7, to get any information that may be missing.
Thank you. Okay. You'd answered a question regarding Cactus. Several other individuals talked about other systems such as ECHO or MD Staff. Is there any integration possible with those systems as well?
Sure, and I think the answer would be similar, which is CAQH, the verified output is made available in a format that can be consumed by IT systems, so it's a machine-readable format. With that said, CAQH itself does not have partnerships with any of these organizations that were mentioned, Cactus or ECHO or MD Staff. So it isn't a built-in, out-of-the-box capability that you would have within your ECHO or Cactus system. It's something that you would have to talk to your Cactus or your ECHO or MD Staff vendor to find out what they could do to actually consume the machine-readable format that Verifide makes available.
Thank you. We have received additional questions, but I'm afraid our time is up. However, please know that we do have both your question and your contact information listed, and for those questions we were not able to address today, we will have staff that gets back with you and addresses your questions. Some of them were very specific to your organization and your needs, and we want to make sure that we address that question specifically. Finally, thank you so much for joining us today. I want to draw your attention to the fact that we do have much more information available on the website. You can visit us at www.verifide.org, or also to our main page of our website, www.caqh.org. On verifide.org, you will find a way to link with members of our business development team who can address additional questions and find out how you can find out if Verifide is right for your organization. Thank you so much. Again, we will be sending a copy of this webinar to you by email, by link. Thank you for participating, and we hope you have a good rest of your day. Goodbye.